Hi, I'm Mrs Lamb from St George's Primary School. I work within the SEN team. A large part of my role is to support children who have difficulties with speech and language. Your child may have already been seen by a speech therapist and given a programme of work or had block therapy sessions. If they have been given a programme, this will be continued within school following the recommendations. When we talk about speech, we are talking about the sounds we produce. These sounds are produced in different areas of the mouth by the movement and placement of the tongue and the lips. Some sounds are produced in the nose and the throat. We talk about noisy and quiet sounds. These will depend on where and how the sound is produced. We screen all children in reception for speech and language using a programme called SpeechLink. This will happen once they have had a few weeks to settle in to their classes. I will visit the classes so that they get used to me and get to know who I am, so that they will feel relaxed and happy to come out and take part. SpeechLink. This is a simple screening where the child is shown a picture and they just have to say what it is. I will listen to how they produce the sounds and use the drop-down box to select the sounds the child is using. At the end of the screening, the programme will generate the scores and highlight if there is an area of need. You will be notified if your child will be working on a speech programme within school. LanguageLink. This is a screening different areas of language and is checking how much your child understands. There are 7 different areas that we look at: concepts, verb tenses, following instructions, pronouns, negatives, questions, verbal reasoning. Before the assessment takes place, I will enter the child's date of birth so that the assessment is age appropriate and scored accordingly. The child listens to the instructions on the computer. 3 pictures are shown and a question is then asked. The spider is under the table. They select a picture to show they have understood the meaning of under. I move on to the next question. Again, the next pictures will appear. Who doesn't have shoes? The sentences become more complex. This is a question, who, with a negative, doesn't. The assessment is delivered at the child's pace. Once the assessment have been completed, it will generate a report and highlight any areas of language that requires some support. Your child will receive support within school, working on the area of need if required. They will be reassessed to check if progress has been made after 6 months. If we feel that progress is not being made, then we would look at making a referral to the speech therapist service for a more intense assessment. This will be carried out in school and parents will be invited to attend the assessment. Dummies. I have to talk to you about dummies. As a soother for small babies, at times they are probably considered a lifesaver, especially at 3 o'clock in the morning. But as your baby develops into a toddler, they begin to build up their muscles to be able to walk, run, jump and talk. mouth has an alien object that consistently restricts it from moving and developing properly, this is when it becomes a problem. Often the child will develop speech problems which are referred to as backing. I will show you what I mean. I'm going to ask you to say, today is Monday. But before you speak, I want you to place your finger on the tip of your tongue and repeat after me. Today is Monday. How did that feel? Could you feel the back of your tongue and the sides pushing up? What did it sound like? Was it clear? Now try saying hello to somebody and keep your finger on your tongue. Hello. As you do this, you will notice that your tongue cannot move at the front naturally. It begins to work at the back, and the muscles work hard in this area, so become overdeveloped. The tongue wants to produce the sounds in the wrong place of the mouth. It can cause the child to push air out the sides, which is referred to as a lateral S, a slushy S. It's food for thought. Next time you sit down with your child to chat, or they may be talking as they are playing, just have a careful listen to how well your child is producing the sounds in the words and how ordered the language is. Thank you for listening. I hope this has given you an insight into speech and language, and I look forward to meeting your little ones in September. Thank you very much.